Do you think it's achievable to have a family and be a surgeon? Yes, is the answer. It's achievable. It will take more, I guess, effort in terms of like just keeping priorities and I guess, protecting time and things like that. But I mean, it's not like every surgeon is single, living alone, without a family. My general surgical consultant said that, he worked really hard and he still works hard, but he still goes home, has dinner with his family most days. And the workload, especially when you do get to the later stages as a consultant, it does get easier in that you're doing less hours and things like that. The point that was also mentioned here, that there's a high burnout rate, I think that's really looking at a kind of a different issue a little bit, because burnout is, again, we talked about this on the podcast, but there's it's quite a complicated sort of topic, and there's lots of different factors involved in it, and some of them are in your control and some of them aren't, and there's a component of your personal resilience and a component of where you're working and who you're working with in the environment. It's lots of different factors there. So you could burn out doing the easiest possible specialty. You could not burn out doing the most difficult, intense specialty. So that's really a different thing. I think if you burn out, anything in life becomes much more difficult, and that's kind of a different conversation, I think. I don't know, did you guys want to comment on any of those?
I do on burnout in physicians, so maybe that's another whole podcast.
Yeah, lots of plugs.
Just to have a family, I think if you ask doctors in general, I think juggling a family life is tricky, but lots of people manage to do it. I think it's just a thing of life, and that includes with surgery. Like, I know lots of surgeons who have got young families and have managed to have a family. Just takes a little bit of extra coordination because of the way the training works, but it's all doable. Yeah, that shouldn't deter you or be a reason to stop you from doing either.
And it is a lifestyle, right? Medicine is a lifestyle. It's one of those professions where like, if you're my sister's an accountant, so a lot of my friends are accountants, so I can say this. If you're an accountant, your life's not going to revolve around being an accountant. You have that as a career and a job, and when you are a doctor, you are in a lot of ways, especially during those heavy training years, a lot of your life is revolving around being a doctor. Like, and I think this is another reason why a lot of doctors will end up having partners who are also medical, because a lot of people don't understand, like, why you finished work. Why do you have to now study? You've just spent 12 hours at work. Why are you spending the next 2 hours studying? Or why are you getting up so early? Or why are you never sort of home? Or why do you have to go into work when you're not rostered
round on a day off?
Yeah. Why do you have to round on a day off? There are things that it's just hard to kind of really appreciate and understand. And it's just the way that it is. And so it's a lifestyle decision. I think anyone that goes into medicine, like, I'm not clinically practicing in medicine anymore because I feel more aligned doing sort of other work. But it's not to say that I was averse to just working hard. I think anyone that makes it through medicine has good work ethic as a base, and you have to work hard to do sort of anything, but it's just about where the priorities kind of lie and sort of discovering that. So especially when it comes to something as big as family, if that's something that's really important to you, I'm sure you will be able to make it work. If you can become a surgeon, I'm sure you can make being a family work. So
yeah. I think there were
3 pregnant registrars on my surgical rotation. One of them was the chief resident, and they all made it work. And funny enough, they were all going to do research whilst they were having their families. So, they were making the most of everything. And they all supported each other. It was a very supportive environment.
Yeah. By the way, if just FYI, Liz, you're 38 weeks pregnant at the moment. In case you hadn't
You have
noticed,
no water break, you're delivering the baby.
Great. It's been a couple years since I've catched a baby. That's what you call it. But yeah, I'm sure I'll figure out a way to call the ambulance.